Doctor, thanks for being here.
Great to be here.
Tell me where we are. This is a level 1 alert. Explain to people what that really means.
Bottom line is that the outbreaks are still not under control in West Africa or in Lagos, Nigeria. What we've done at CDC is to increase our level of activation. That actually doesn't affect anyone outside of CDC. That's just so that we can surge and provide effective support to the response.
Is this the biggest outbreak?
This is the biggest outbreak of Ebola we've seen ever. In fact, it's unprecedented in 5 different ways. It's the biggest. It's the most unique in terms of multi-country. It's traveling from one country to another. We've not seen that before. It's in West Africa, which we've never seen before, so they're not familiar with it. It's also in urban areas, which we have not seen before and has new challenges and big challenges. And it's the first time we've had to deal with it in this country, not actually because of the 2 people in Atlanta, but actually because of travelers who are coming in from West Africa, because there's a lot of air travel.
So what's the biggest concern? That airlines don't pick up passengers who are experiencing these symptoms?
The biggest concern is we have to stop it at the source in Africa. That's how we're going to not only stop it there, but protect ourselves best.
But have airlines been notified to look for sick travelers?
We've worked with the airlines, we've worked with immigration, we've worked actually with these countries to help them find people who may be sick or may be contacts and try to have them not travel. But the best way to stop it, the only way to effectively protect not only Africa but us, is to stop it at the source. And Ebola is so hard to manage because you have to get it right. It's like a forest fire. If you leave just one ember burning, it flares up again.
But it doesn't look like anything different. I mean, somebody getting on a plane exhibiting symptoms that would normally be flu-like, right?
Ebola is not possible. It's not possible to diagnose Ebola without a laboratory test. That's why we're telling doctors in this country, if you've got a patient with fever, take a good history. See if they've been in West Africa, Liberia, Guinea, Sierra Leone in the past 21 days. If they have been, isolate them immediately and get them tested for Ebola.
You know, people here, they hear the president, they hear you saying this can be contained. There is not a major threat for an outbreak here. But then they hear about people being tested all over in different states. And, well, it's just scary.
Sure. It's normal to be scared of something that's deadly. What we have to do is take that fear and change it into something really useful, something that works. We have to take the fear for people who are taking care of the patients with Ebola and turn that into meticulous infection control. Take that fear for doctors and take it into, let's consider Ebola and get them isolated and tested immediately. Let's take that fear and transfer it into the kind of activation that we're doing to stop the outbreak in Africa.
To be clear, it's direct contact only, fluids, bodily fluids.
It's only spread from someone who's sick with Ebola and only by bodily fluids.
Not airborne.
It's not airborne person to person. That's not what we're seeing. The way it spreads in Africa, fundamentally 2 different ways. 1, caregivers in the home or in hospitals. 2, burial practices. There are some burial practices in Africa that we don't have here that involve washing bodies and having close contact with people who've just died. Those are the 2 engines of the outbreak in Africa. If we stop those engines, we'll stop the outbreaks.
When specifically are people contagious? When they're exhibiting those symptoms?
People are only contagious when they're sick with Ebola. If you get exposed, you'll get sick. If you get sick, probably around 8 to 10 days later. It could be as little as 2 days or as much as 21 days, but most people it's in that 8 to 10 day window. And until you're sick, you cannot make other people sick.
But isn't there a threat that someone traveling may not be exhibiting any symptoms now, they arrive in the U.S., and then they get sick?
That's exactly why we want doctors to think about asking people who come in with symptoms where they've been. If they've been to West Africa, Liberia, Guinea, Sierra Leone in the past 21 days, and they've got symptoms that might be Ebola, isolate them immediately, get them tested. We've already had 5 patients in different parts of the U.S. who've come in with such symptoms. All of them ruled out for Ebola. 2 had malaria, 1 had flu. But this is actually, in a kind of paradoxical way, this is a good thing. This means that doctors are thinking about it and testing, because the real risk is that we could have someone who would come in. We're not going to hermetically seal the U.S. We are connected with the rest of the world, whether we like it or not. That's why it's so important that we control it in the West African countries where it's spreading. That's why we're strengthening their ability to screen travelers leaving, and that's why we're alerting doctors in this country to test for Ebola among people who have been there in the past 21 days.
Despite the fact that it is so scary when people think about it, we've been reporting all of the confidence that you have, that the government has, that you can contain it, that it wouldn't be an outbreak here. For people, however, who now are trusting your judgment and the government telling them that their confidence is high, they look at the investigation into the CDC where the anthrax bacteria was the safety lapses just recently in the past couple of weeks. And they say, how are we supposed to trust you now if there were such big safety lapses back then?
CDC basically blew the whistle on ourselves. We identified two problems in two different laboratories that were really serious and shouldn't have happened. And I think we did what was right. We went public with that. We took immediate action to stop it. We've continued the testing in the Ebola response, hasn't interfered with our response, but it does emphasize how important it is to follow protocols and for healthcare workers taking care of Ebola patients to remember that that kind of meticulous attention to detail is exactly what we need to stop the disease.
So if you have one message for people out here following that story closely, what would it be?
That the key with Ebola is to stop it at the source with the tried and true, proven public health methods of finding patients with the disease, isolating them, finding their contacts, good infection control. Every outbreak of Ebola to date has been stopped. We can stop this one. It's not going to be quick. It's going to be a long, hard fight, but we can do it.
And the prospect for these two Americans?
You'll have to ask them. Generally, the way Ebola works, you get very sick and then you either get better or you don't. So it's encouraging how they're doing, but really it's a day-to-day thing, and the recovery from Ebola often takes many weeks or even months and is often characterized by a lot of weakness and a long road.
But is the vaccine showing promise?
The experimental treatment they've been given is unproven. We don't know if it helped, hurt, or made no difference, and there's not very much of it. The key is we know now how to stop Ebola, and for patients with Ebola in Africa, we know how to reduce their risk of dying by giving them fluids, good hospital care, antibiotics if they get another infection. Supportive care works to reduce the death rate in Ebola.
Fair to say an outbreak anywhere is a threat everywhere?
An outbreak anywhere is a threat anywhere. We are all connected by the air we breathe, the water we drink, the food we eat. We have 50 million travelers a year into the U.S. They're essential to our economy, to our families, to our communities. We're not going to hermetically seal the borders. We're involved in the rest of the world, and that's why we elevated to level 1. That's why we're putting at least 50 disease control experts on the ground in Africa. It's going to be a long, hard fight, but I'm confident that we can reverse it.
Thank you so much for being here.
Thank you very much.